The Senate Committee on Health, Education, Labor, and Pensions will please come to order. I think it's pretty well established. The American people are having a hard time affording health care. Prices are up for everyone, and the status quo is not sustainable, and they are looking to Congress to work together to find solutions. In July, this committee discussed affordability across the entire commercial insurance market. Today, we're looking at why costs are going up so much within the individual and small business marketplaces, because if you're in those marketplaces, you're paying more and you're getting less. During the COVID pandemic, Democrats passed extended temporary enhanced premium tax credits, or EPTCs, which ultimately send money to giant, highly consolidated insurance companies. And I'm not knocking insurers, they're essential to our society. I'm just pointing out, and by using these subsidies, they were hiding the true cost of the premiums. Now, this doesn't actually lower the cost of health care. It masks it. It papers over it. It puts a Band-Aid on a broken bone. Now, let's get some facts. In 2014, taxpayers covered 68% of the Obamacare exchange's enrollees' premiums. By 2020, that 68% had become 80%. From 2021 to 2025, the era of the enhanced premium tax credits, if you will, the taxpayer share grew to 93%. Now, despite this increase in subsidies, total premiums never decreased. The enhanced premium tax credit just masked the cost. In fact, increased subsidization actually increases the price for the unsubsidized and the small group market when they are included in the same actuarial pool. Think about that. Subsidizing the sum increases the premiums for those who are not subsidized but who are in the same actuarial pool. Now, how do we address this? We should go to the root cause of rising healthcare costs. Now, to be sure, we're having two conversations here. One, how do we lower healthcare costs going forward, period, just from here to eternity? And a very immediate conversation about January 1, 2026. What do we do for those folks, particularly those who are in their 50s and their 60s, on the exchanges for whom the premiums have become unaffordable and because of their increased use of health care, have having to put more of their budget to this? Now, Republicans are not interested in the status quo. We want, I can tell you as a doc, putting a Band-Aid over a broken bone does not help anything. But Republicans are absolutely interested in figuring out a solution that can make health care more affordable and health insurance more affordable from 2026 and beyond. Now, I'm speaking to both sides of my dais right now, my Democratic and Republican colleagues. I'm hoping that we can find a bill that can get 60 votes that can fix the problem of the exchanges for January 1, 2026. It shouldn't be a Republican solution. It shouldn't be a Democratic solution. It should be an American solution. And this is a committee of jurisdiction. So I'm asking us not to yell at each other, not that we do, maybe occasionally, but let's find a solution. Because the American people are looking at us to find a solution. Now, we can push for big ideas, grandiose ideas on the right or the left, but we got to have a solution for 3 weeks from now. So, Senator Sanders will speak about Medicare for all. That will not be ready in 3 weeks. In fairness, people on my side will speak about things that cannot be ready in 3 weeks. We should focus our minds on what can get done by 3 weeks from now. Now, that means we have to build on what we have. Neither side's going to particularly like that. But if we're going to do something in 3 weeks, we've got to do it in 3 weeks. And if you want an American solution, not an RRD, that is the reality. Now, there is a sweet spot, that which Republicans and between that which Republicans and Democrats would like to do, knowing that we have to have a solution in 3 weeks. We've got three choices. We can do nothing. We accept the premise that no deal is possible, that the enhanced premium tax credits go away, that no reforms are made to a failing system, and we have a failed floor vote where there's a Democratic bill and a Republican bill, and they both go down and the American people are not served. That's one option. Alternatively, we can roll up our sleeves and seek out something we can all live with. Now, from my perspective, that recognizes that increased support for some patients, for some people, must continue. It also, though, includes shifting dollars away from the current structure of the enhanced premium tax credit, 100% of which goes to insurance companies, and repurposing those dollars for pre-funded health savings accounts paired with the Bronze Plan, because when you put it in an HSA, 100% goes to the patient. By the way, when you give it to the insurance company, 20% of that goes for overhead and profit. When you give it to the patient, 100% goes for the health care they need. Now let's address the elephant in the room, or in respect to my Democratic colleagues, the donkey. There are people with strongly held positions on the issue of life or choice on both sides. Let's just acknowledge that. And let's have an honest conversation. I am pro-life, and I'm not going to compromise that. And I know people who are pro-choice, and they don't wish to compromise that. But we've found ways through the annual appropriations process to find common ground for many years. So let's just not say right off the bat, oh, we can't address that, and then allow the people in their 50s and 60s to have unaffordable premiums. Let's try and find a way that we can all live with this incredibly important issue, no matter what side of that issue you are. Now, President Trump supports the concept of this third approach, which clearly strengthens its chance of passing. I'm pleased to say I've had Democratic colleagues in both chambers with whom I've had productive conversations. Again, they want an American plan, not a side-by-side Republican and Democratic set of plans, both which fail. Like so much fails here in Congress. The American people want something to pass, so let's find something to pass. Let's give power to the patient, not profit to the insurance company. Let's make health care more affordable again. And with that, I recognize Senator Sanders.